Hello everyone, welcome back to my channel. And in this video we'll try to explore and try to debunk certain myths about autism. Now autism is actually called as autism spectrum disorder. Alright, and when we say that this is a spectrum, it actually means that there are a whole range of presentation, a whole range of symptomatology that we have to understand. Now, every child is unique and their journey is unique. Now, when it comes to autism is not a puzzle that has to be solved or it's some kind of a limitation. It's just a different way of connecting with the world. It's a different perspective to see the world. So, that is exactly how I defined it. That it's a different perspective from the eye of the child to see the world around them. Now, the range of symptoms can be varying from social or their behavior or their way of communication or some motor functions or sensory functions and then intelligence quotient. Now, from my experience since past decade, and probably a lot of medical professionals, a lot of general physicians, a lot of pediatricians will tell you the same, that there is a 70% spike in the prevalence of autism, and more male children are seen to come with autism. Right now, what exactly, how does it is observed? We really have to rely on the observation of the parents as well as the teachers or the caretakers of the child. Now, when we see the presentation or the clinical features of autism, we notice that there is a very major deficit socially. So the child will not engage with people around. There is very minimal or no communication verbally as well as non-verbally, and there is difficulty in establishing relationship with people. So the child will find it very difficult to have this bond to develop. There are certain patterns or activities that also needs to be noticed, such as repetitive activities or repetitive speech that we can observe. Now, these children are usually routinistic children, so they will be very comfortable in a particular routine day-to-day activity. A little change in the routine and the child will go into a different mood, which will be uneasy for the child and the parents. Now, their reactions to any major change can be hypo, meaning they would not react at all, or will be hyper. So excessive reactions, excessive moods and emotions. Now, when it comes to the interest of the children, they usually have fixed interests. Again, certain activities, certain toys, certain choices, certain taste, flavors, colors. So they will love specific things. So fixed interests. And their sensory input will be disturbed. Now, nowadays, we have seen that ADHD, attention deficit hyperactivity disorder, and autism is comorbidly diagnosed. So, a child can have both of them. Now it's very important to be very careful before we give the diagnosis of autism. Until as the child is 3 years and above, this diagnosis really should be carefully given. I see patients coming as with kids as young as just 12 months or 14 months old, and they have an apprehension that the child might be autistic, but it's not that. Before we give the diagnosis, we need to be very, very exclusive with their presentation. Right. Now, some of the red flag symptoms that a doctor might observe are no big smiles. So the child is not that smiling child. No sound sharing. And babbling is delayed. The child is more than 12 months old and the babbling hasn't started, which usually starts around 6 months of age or so. There are no gestures or pointing out in the child. The child is not expressive or does not have any gestures at all. And no words. The child hasn't started speaking any word, and the child is above 6 months of age. And no 2-word phrase. 2-word phrasing hasn't started, and the child is over 2 years of age. And sometimes a patient can come with a child who was speaking or had started speaking, but all of a sudden there is speech regression. So the child has stopped saying what he already was speaking. So these are some symptoms that can be red flags. Along with that, you can notice that there is no social referencing. You can also observe that the teacher or the parent or even a doctor cannot grab their attention towards them. They are busy in themselves. Sometimes hand flapping is observed in these children, or some kind of repetitive movement. It can again be varied. So some repetitive movements can be seen. And in any situation where there is sensory overload, especially when there are a lot of people around and the child is not comfortable with, let's say you go to a party or a social event with loud music or bright lights or too many people, the child may have a meltdown episode. Right. Now, the earliest sign that is seen in children of autism is absence of normal behavior. That is the first thing that a child might trigger in the minds of the parents. Some kind of a milestone will be absent or grossly delayed. And some presence of one of these symptoms that I already told you. Of course, we have to give the diagnosis, we really have to go by the history from the beginning. We have to go by the words of the parents, their observation, and what the teachers and the caretakers have noticed. Of course, the evaluation must be done by specialists. Commonly, these patients will also sometimes have some gastrointestinal symptoms where especially when talked about their food choices, they may have aversion towards certain textures of food or even colors or dress choices. So they will be very, very picky coming to these. And there is also something called as selective mutism, which is very similar to this, but it is different. Very common again these days when the children are holding phones as young as a 1-year-old or a few months old child, and they choose to be mute because their eyes are more stimulated than their mouth. Now, when it comes to investigations, of course, before giving the complete diagnosis, we must go for hearing and vision evaluation. CBC could be done. Thyroid function, very important. These tests should be advised. EEG can be done. If need be, MRI can be advised. And sometimes chromosome testing is also advised by the specialist. IQ, DQ tests and scoring is also done. There are a variety of, in order to manage these cases, there are a variety of therapies that can be done. Speech therapy and many different therapies where they focus on what the child can do and not really on what child cannot do. That is the whole point of giving such therapies. And along with that, parental psychoeducation is very important because this is a very sensitive topic and it can trigger the minds of the parents and really worry them. Now, when it comes to homeopathy has a very individualized approach, and we have got some medicines which are chosen based on the unique emotional and behavioral patterns of the child, aiming to improve their communication, reduce their sensory overload, and enhance their general well-being. Many remedies are there in homeopathy. I just feel that there is no point listing out because I will be missing out on so many important remedies. So I will be coming up with homeopathic remedy videos individually very soon. But in case there is a parent hearing this video or watching this video and they want to know that whether homeopathy is effective in case of in autism, yes. So please go and connect with your homeopath, and there is a huge chance that your child will be helped. Thank you for watching this video. Please do remember that autism is not a puzzle to be solved. It's just a different perspective of the child. And there are so many ways that we can help the child to be able to socially and emotionally be good in life. Thank you so much.